Welcome back to the Bluffton News. Now we've got Dr. David Remigio here. He is an ophthalmologist at Coastal Carolina. Dr. Remigio, welcome to the show.
Thank you. Glad to be here.
So we're talking about eye health today. First of all, how often should you get your vision checked? And do you find that your patients actually follow the recommended schedule?
That's a very good question. Not everybody is as compliant as they should be. Generally, it's not a simple answer. I would say you cater it to the particular patient. For example, you should get your eyes checked every year if you're a diabetic or hypertensive, including a dilated fundus examination, where your pupils get dilated and you're blurry for a few hours and everything seems bright to light. All the bright lights seem more bright than usual. Otherwise, I would say it depends on your family history and your medical history. I would say every 2 to 3 years if you're not symptomatic and you don't have any special eye needs. If you're a contact lens wearer, you should probably get checked every year. But specifically in this retirement community, I would say get your eyes checked once a year if you're diabetic or hypertensive. Other than that, I would say it depends on the symptoms or problems that you're having.
So when somebody feels something and then they don't come in and then they finally do you see some crazy stuff or is it pretty normal?
Occasionally you will. Usually the more serious things will persist. The problem that you can run into is sometimes people will lose vision in one eye, especially if it's gradual, and not know something's going on because their other eye still sees 20/20. So very often, in regards to your question, I'll see people that lose vision slowly in one eye, but because they're still seeing 20/20 in the other eye, they don't complain of it. And it may take months or even a year before they close that good eye and realize their vision has slowly gone away in the other eye. So that's a rare thing. I think I've seen a retinal detachment occur that way, where they were completely blinded in one eye, but because they always had the other eye open, they never noticed it until one day they closed their good eye. But for the most part, usually significant problems bring them in pretty quickly.
Now, do we have any, I don't know if there's a geographic link, whatever, as far as, ophthalmology is concerned or things that you see. Do we have anything that's particularly common in our area? Does that happen in your field?
Yes, there are geographical problems, endemic problems that are specific to certain areas. Let's speak about this area specifically for a second. This is a retirement community. People are outdoors a lot. It's a very sunny area. There's a lot of fair-skinned individuals here. So I would say this area, you see a lot of skin cancers. You see a lot of sun-related problems because people, again, are outdoors playing golf, playing tennis. So I see a lot of skin cancers on the eyelids and around the eyes. I take off a lot of skin cancers around the eyes because I'm an oculoplastic surgeon, meaning I do a lot of plastic surgery around the eyes and the upper face. So sun protection, sunglasses, hats, those are key things that people should do here. Also, allergies are very common to this area, so you'll see a lot of people with itching and burning eyes from allergies, and avoiding the allergen, number one. Number two, using antihistamines and using anti-allergy drops help as well.
So we touched on this very briefly just a little bit ago, but what kinds of things bring people into the hospital?
Okay, probably one of the most common things bringing people into the emergency department or the ER are sudden loss of vision.
So it can be sudden as well as gradual?
Exactly.
Okay.
Gradual things don't bring people in that emergently. They'll usually cause someone to make a regularly scheduled appointment, maybe come in and see their doctor when they're already scheduled to, or they'll make an appointment. It's not so urgent. But what brings people into the hospital are usually sudden changes. A lot of vascular events, say a stroke in the eye or decreased blood flow in or out of the eye, can produce significant sudden changes, and that usually scares someone. If they notice something suddenly, they'll go to the hospital right away. Trauma is another one. You see a lot of people, again, playing sports. I've seen eye injuries from golf, tennis, or any athletic event where they're not wearing eye protection.
Well, I certainly don't want to speculate on what a golf or tennis injury to the eye might look like, but tell us how we can protect ourselves. So we talked a little bit about sun and radiation and things of that nature, but what should we be doing to keep our eyes safe and healthy? In
regards to the sunlight, which exposes us to ultraviolet radiation, the simplest and easiest thing is to avoid direct sunlight. So example, if you're going to be at the beach, cover up, wear sunglasses and a hat to keep direct sunlight off of your eyelids and your eyes. Cataracts, possibly even macular degeneration, and certainly skin cancers are all made worse by ultraviolet radiation. If you get a good pair of sunglasses that blocks all the UV radiation, it's certainly going to help protect your eyes significantly. Playing sports, some type of sports glasses or even sunglasses are better than nothing. I've seen golf balls deflect off of trees or off of obstacles on the course and come right back and hit people in the eye. I've seen people chop down at golf balls in the rough or in the dirt and have pieces of rocks or mud fly up and get them in the eye as well.
Well, on that happy note, I shudder to think of what that looks like. But Dr. Remigio, thank you for sharing your expertise with us today. We very much appreciate you being on the show.
Thank you. Glad to be here.
Thank you for joining us for this special edition of the Bluffton News. Be sure to like us on Facebook and follow us on Twitter at WHHI-TV. We'll see you soon.